welcome you all to the 2026 cohort of the Stop TB Canada Steering Committee and to our first quarterly meeting. So my name is Lee Wraithby, and I've been supporting Stop TB Canada for the past 5 years, in which time I've seen this network grow in size and ambition and impact, and it's been really amazing to work with this group of dedicated volunteers and see our work pay off as we're continuing to build a reputation and a name for ourselves in Canada. So it's been really cool to be part of this group and loving to see it grow. I do feel like I should acknowledge that at the last quarterly meeting we held at the end of 2025, I left you with a dramatic goodbye as I recently relocated to Copenhagen, but clearly it's really hard to leave this group. So I just wanted to mention that I'm staffed on a short part-time contract with Stop TB Canada to advance some of the administrative work for the network. But my previous role as secretariat has been officially taken over by Iris, who you will meet shortly on this call. So I think we can start sharing the screen, Iris. And I can provide a bit more context for these meetings. So we hold these quarterly meetings to bring the whole steering committee together, align on current projects, brainstorm ways of working, and look ahead at upcoming opportunities for us to work on to advance our mission. We do take attendance at these meetings, and we also record them just for note-taking purposes, and so that members who are unable to join can review the conversation afterwards. But the recordings are not shared publicly, so we hope that you all feel that this is a safe space to share your thoughts and ideas with the group. Next slide, please. So we have 90 minutes together to cover the following agenda items. We'll hear from Petra, our returning co-chair, for a warm welcome and kind of quick overview of our work. We will then welcome some of our new members and allow the new additions of the team to briefly introduce themselves and their work. Unfortunately, in the interest of time, we won't be able to hear from everyone, but I'd encourage returning members to just introduce yourselves in the chat for now, and then I'm sure we'll all get to know each other better over the coming months and in smaller working meetings. Then I'm going to provide a high-level overview of kind of what you all signed up for and what it means to be a member of the steering committee for Stop TB Canada and some of the expectations that we have for our members. And then provide some of the feedback that was received from our returning members in our end-of-year survey in the end of 2025. So that covers some of the responses to open-ended questions regarding what worked well as a network, where could we improve, and some of the suggested priorities for us to focus on through 2026. Then I'm going to pass it over to some of the other members of the team to shift a conversation towards our work through Q1 and some of the specific plans around key moments, including World TB Day and some upcoming conferences. And then we'll pass it back to Petra to share some updates on recent conversations and developments in terms of Stop TB Canada's operations. So she will provide some background information on how Stop TB Canada, which is a volunteer-run network, has started exploring opportunities to professionalize and secure funding. So we're really excited to share some of those updates with all of you. And this is a lot to cover. We always have a lot to say in these quarterly meetings, but we do hope to have a couple minutes at the end for any other business where we can perhaps open up for some project-specific discussions or time-sensitive tasks for us to be focusing on over the next couple of weeks, or anything that we might have missed in the overview of events and priorities. So that's what we're hoping to get through over the next 90 minutes. And to kick us off, I'll pass it over to Petra, our co-chair.
Hello, everyone. It's really, really lovely to see so many new faces and to see the movement of Stop TB in Canada grow and vibrant. And I'm excited to meet all of you, and I'm very happy that you got the chance to join. Also very happy that many of our current steering committee members have actually stayed on, meaning their real commitment to keep the work going is in place, and lots of ideas that Lee will share in terms of what Stop TB Canada should be focusing on or could be focusing on. So there is some good momentum in this group. I think in general, and you'll get a slide after this where we refocus on what Stop TB Canada specifically is, but it is really a community of practice where we share information. Oh, okay, here's the slide. So where we come together as a community, and from different professional backgrounds, from different sectors, different provinces from Canada, and we all are along the mission and a vision to end TB in Canada. And the timeline of the strategy within Canada that is very soon going to be officially a national-wide TB elimination strategy, which is hopefully going to be announced by the Public Health Agency of Canada in April, is to eliminate TB by 2035. So we are on a 10-year campaign where we're already 1 year in. Or maybe a few months in. I'm a little ambitious here, but there's a really specific timeline that we can be working on. And as community, this is a really strong. We have some strong milestones for us to be advocating, raising awareness, promoting policy actions on specific items that we have been doing some of this work. So last year, the domestic working group has led us in the work on access to TB medicine, where we did a survey and we brought a report out on access to TB medicine. And lots of discussions, webinars, meetings with departments, government departments, provinces, has really tried to push the work forward and to put the issues around access to TB medicine within Canada in the spotlight through news, through stories, through whatever we could do. So I think that is a very good example of the collaborative work of just Full Energy. And I see that Lee is sharing the annual report in the chat. So please have a look. You can see some of our work. I think that is a very good example of the work that the domestic working group is doing. And right now there is a access to TB diagnostics survey on the way. So that is basically a following on to the access to TB medicine. And there's definitely enough advocacy points that will be coming out of that work as well. So just to kind of share a bit more of where we are promoting policy action, and we closely collaborate with results on the global work. So the global working group has been very active in the replenishment of the global fund for the last year. There was a massive gathering in Ottawa in September, where many of you were present as well, where we all lobbied parliamentarians, where we raised awareness around TB and also the need for replenishing the global fund. And even though we didn't get the 1.2 billion that we asked for, I think compared to many other bilateral donors, traditional donors, we should be very proud that Canada donated 1 billion to the global fund. That is in proportion a large amount of money. And I think we also need to realize that with all the restructuring and consolidating that's going on within government, Carney's agenda is slightly different than maybe in the past, how international development has been put forward. So to have this under his current cabinet coming out as his first investment in development is something that we should be really seeing as a win. GAC has been always a steadfast promoter of tuberculosis work globally. They initiated the Global Drug Facility, the TB Reach, and they continue to champion this work. So they're a strong ally in the global space that we work with. And I think we can be proud to see that they're also helping us to raise tuberculosis as a domestic issue. So the translation of what the countries, let's say in the South, are doing in terms of innovations to bring some of these innovations back to Canada that will benefit people in the North or newcomer populations are definitely things that we are looking at. So I think what I just want to say for this year, and Lee already hinted at it, it's we're at a stage where we're now growing into a network that is solid and strong. And when we want to really maintain this movement, we'll need to professionalize. And we've been incredibly grateful to be leaning on people's energy and passion and off the side of the desk, voluntary power. And And not to forget results, kind of strong leadership behind the scenes. Definitely in the global advocacy, it has been more than only Lee and Iris. It has been a whole power and force to put campaigns together. But I think what we are trying to go towards is a structure that actually has a secretary to support some of the work in the domestic working groups and in the global working groups with some project management power. So we'll talk a little bit more about that later on. I think for now, I want to acknowledge my wonderful co-chair, Tina Campbell, who's right now not here. She has some private family matters for the reason. And I'm sad to see that Tina is kind of ending her term. She already stepped up as 1 year extra. So Tina will has been a fantastic voice for Stop TB Canada, whether it was within the UN or whether it is here at home or whether it is in front of Parliament. She always says the right things, and very happy that she'll stay involved in Stop TB Canada, and it's been amazing to co-chair with her. So I think, and we'll touch upon that in at the end of the agenda as well. So I'll pass it back to Lee in this stage.
Thanks, Petra, for that overview. That's really helpful on kind of what we're focused on right now. I'm now going to pass it over to Iris to introduce yourself and open it up for new members to introduce themselves briefly as well.
Thank you so much, Lee. Sorry, I'm just admitting people as I was sharing my slides. I could not admit them. Hi, everyone. I'm Iris. Thank you for the previous introduction. So I took over Lee's role as representative of Results Canada for Stop TB Canada, but also as Results Canada TB lead. And it's been a few months now, but I've been very grateful for Lee to have been here and for having guided me throughout these last 2 months. And now I'll just pass it over to our newest members. We have 8 new members, which is fantastic. And we now have 29 members with 8 new ones. So I just wanted to acknowledge that one of the members, Olivia Oxlade, is not here today. She is Associate Scientific Director at the McGill TB Center for people that don't know her. But I just wanted to introduce her as she could not attend today. And I'll pass it over to Crystal to present yourself. If Crystal is here. I don't think she's here. Okay. Apologies for that.
Hi there. Sorry about that. Having some technical difficulties. Can you put the video on? Hi, everyone.
Oh, hi. I'm just helping her with her difficulties. You can go now.
So, sorry, I missed what right before my introduction. Please repeat.
If you can just briefly introduce yourself to the rest of the steering committee and what's your expertise or your background in TB and why you joined, that'd be fantastic.
My name is Crystal Favreau, not Scott. My expertise or background is more so my lived experience. Over the last year or so, I have been providing some insight to some research methods groups at McGill, as well as the hospital I attended at West Park. And I'm excited to be part of the team to help give some of my insight on how the lived experience affects the treatment as well as isolation and post-treatment.
Thank you so much. I'll pass it over to Dinesh, if I pronounce it correctly.
You did great. Thank you. Most people do not nail Dinesh on the first try. My name is Dinesh Meyer, and I'm with the Canadian Red Cross, and I have the privilege of being the program manager for our Nunavut tuberculosis project. So we have mobile public health teams supporting the government of Nunavut with their TB strategy. And in particular, I run a team of public health and clinical professionals who deploy. Currently, they're in Arviat. And I'm sort of also representing the Red Cross as a whole. We do have a new public health team project that will be supporting TB work in Nunavik as well, but that's just a new launching program on behalf of the CRC. So I work with that team, but I am not fluent enough in French to lead it. Thank you.
Thank you so much. I'll pass it over to Krish.
Oh, hi. I'm Krish. I'm a practicum student actually at the University of Alberta. I'm one of Courtney's students at the Tuberculosis Program Evaluation and Research Unit, and I'll be helping out with the diagnostic survey that Petra mentioned at the start of the meeting, and helping out with some of our data analysis with the Stop TB Canada tracker.
Thank you. I'll pass it over to Jody.
Hi, thank you. My name is Jody Bafakala. I am based in Edmonton. I have worked for many years in South Africa. I work for the TB think tank there, which is an umbrella organization for researchers and clinicians, and we help direct policy and work very closely with the National Department of Health in South Africa. So I was involved in their strategic plan writing, and still involved in a lot of research in South Africa with the Aurum Institute, but now based back in Edmonton and wanting to get myself reintegrated into the Canadian TB landscape. Thanks.
Thank you so much. I'll pass it over to Mayema, if I pronounce correctly too.
Yes, you pronounce it very well. Thank you very much. My name is Mayema. I'm an international medical graduate and public health specialist. I served as the deputy TB program manager in Lesotho, while also working as a consultant of WHO in several high-burden TB countries across Africa, but also supported USAID in some countries and some projects. So I'm here in Newfoundland in St. John as a graduate student at the Memorial University, from where I want to join the fight. I want to continue because this is my passion. I could just not focus on my study, but when I got this opportunity, I said, let me join, network, and continue to work together, integrate the TB community in Canada, especially in Newfoundland, where I'm settled. Thank you. Nice to meet you.
Thank you. Nice to meet you. And I'll go with Patrick.
Hello, everyone. Yeah, my name is Patrick Mundanyira. So thank you for welcoming me in this steering committee. I worked in Lesotho in different organizations, Beira Pediatric AIDS Foundation. They have a children foundation. I was involved in pediatric HIV care and treatment, and as a medical doctor, then I worked with Elizabeth Glaser Pediatric AIDS Foundation in Lesotho, where I was providing my technical assistance in HIV and TB as a technical advisor. Then I moved to Partners in Health, still in Lesotho. Then there I was working. First, I worked as a clinician in the Botsavero MDR TB hospital, where I was a clinician and also involved in the NTB clinical trial as a study investigator. Then I moved to also another position as a health reform program lead, where I was also helping with health system strengthening program, and I'm excited to be here. I'm based here in Gatineau, next to Ottawa, and I'm currently here in Canada, and I would like to continue to support TB effort and join all of you to this effort to eliminate TB in Canada and globally. Thank you.
Thank you so much. And finally, Julia.
Thank you, Iris. Hi, everyone. My name is Yulia Chorna. I'm currently in Toronto doing my doctoral studies in social anthropology. I'm working on my dissertation, which is devoted to the research of global tuberculosis funding. My previous background is in social work, focused on policy planning, community organization, administration. I worked in Ukraine and across Eastern Europe and Central Asia, leading Tuberculosis Europe Coalition before I came to Canada in 2020. I also worked at Alliance for Public Health as a TB advocacy manager for the regional project called TB-REP. So it was about drug-resistant TB and transitions to people-centered models of care. I'm very happy to join the steering committee. I thank you for this opportunity because I'm eager to learn more about Canadian context and integrate more of my skills and and my passions to end TB in Canada and abroad while being a part of the steering committee. Thank you.
Thank you so much, and sorry to have put you on the spot, but it's really nice to hear about you and your background, and I'll pass it back to Lee.
Great. Thanks, Iris. And it's so exciting to have you all joining the steering committee. I think I speak for all the returning members and just saying that we're looking forward to working with all of you and getting to know you better. Again, I would just encourage returning members to maybe introduce yourselves in the chat. It would be great to have time for us all to introduce ourselves, but that would take the whole meeting probably. So that would be great if we can utilize the chat. I think there is a slide with a map for all the steering committee members. There we go. So this quarterly meeting is a bit more focused on the administrative side and onboarding. So forgive me if it gets a bit technical about our governance, but I think it's important to kind of cover that before we dive into the projects and the bulk of the work. So for starters, I thought it would be interesting to just kind of show where you're all situated. Here's a map of the steering committee distribution, noting that we do have one member who is currently based in France, and that this map also doesn't include members of the Secretariat. And the Secretariat includes myself, it includes Ekta and Iris from Results Canada. It includes Sharanya, who is our part-time communications consultant, and Michelle, who is our treasurer on behalf of the BC Lung Foundation, which we will touch on more a little later in the call. So you can see that the bulk of our members are based in Ontario and Alberta, a handful in Quebec, a couple in Saskatchewan, and then one member in BC, Manitoba, and Newfoundland. So we're slowly increasing our distribution across Canada, which is really great. And I would encourage you all to at least add each other on LinkedIn, but also maybe connect in person if you are based in the same city, because it's nice to connect with like-minded folks. So next slide, please. And while we do recognize that you're all taking this position on as volunteers, I would like to just briefly cover some of the terms that all steering committee members are expected to meet so that we're all on the same page from the start of the year. So at a minimum, steering committee members are expected to actively participate in quarterly meetings. So this meeting that we're having right now, it happens at the beginning of each quarter. Meaningfully engage in at least one working group, which I'll touch on in a moment. So we have the domestic, the global, and the operations. Feed into Stop TB Canada assets and projects where it makes sense. So it's very ad hoc. If there's a project that's relevant to your expertise or your interests, we just are expecting you to kind of chime in where it makes sense and where your capacity allows. We expect steering committee members to represent Stop TB Canada at various domestic and international events. Let's say in your day job, you're participating in a conference. It's always nice to have kind of a Stop TB Canada representative in these spaces who can speak to our work. Join and help promote Stop TB Canada events and take strategic actions to advance our work. So some of these asks that we'll have throughout the year, I've listed a couple examples, such as emailing your member of parliament, posting on social media, basically to amplify our campaigns. And then to go above and beyond, steering committee members can co-lead one of these 3 working groups. You can volunteer to moderate or speak at Stop TB Canada events like webinars, or you can lead or manage a specific project. So those are the terms of reference, which everyone should have seen and agreed to, but happy to answer any questions, perhaps offline if you'd like to go over anything in detail. Next slide, please. So here I just want to expand on our ways of working. So in recent years, we've been really pleased to see an increase in interest for the steering committee, and we've welcomed several new members. And to manage the larger team, we decided a couple of years ago to divide our work based on focus and divide our team into 3 distinct working groups. We currently have a domestic working group, which focuses on projects and engagements related to TB in Canada. We have a global working group, which focuses on projects related to TB globally. And then we have a operations working group, which focuses on the governance and sustainability of Stop TB Canada as a network, including some of the processes and partnerships and fundraising that keep us going as a network. So this graph indicates the responses that we received in the end of year survey from our returning steering committee members, where they were asked which group they would like to participate in. And we have 14 members interested in the domestic working group, 11 in the global, and just 1 in the operations working group. But please note, we do have the members of the Secretariat are also members of the operation group. So technically we do have a handful of members, but it's definitely the smallest of the working groups. Each working group is led by 2 co-chairs who are listed here. And in an effort to reduce the workload of single members who end up taking on kind of a disproportionate share of the work at a given time, we're hoping to cycle the co-leads, perhaps at the midpoint, but this is something that we can come back to in terms of what works for each working group. Just to give people a break and also give new members the opportunity to lead. So feel free to reach out if any of you are interested in taking a co-lead role in the future. And you are welcome to join as many working groups as you'd like, but I just would note that each group meets on a monthly basis and carries out respective projects and work streams. So just be mindful of the time commitment that you're selecting. And lastly on this, we are aware that the new members of the steering committee have not yet been assigned to working groups. So I just wanted to note that I'll be reaching out to each of you to learn what your preferences are, and then we can match you with the group that makes the most sense for your expertise and interest. Any questions on the working group before I move on? Okay, next slide, please. Okay, so here I'm going to take just a few minutes to review some of the responses from this 2025 end of year survey that I mentioned, which all the returning members completed at the end of the year, to open up for a discussion on what worked well, where we could improve, and what we should be prioritizing as a network. And this conversation is going to help build out our work plan for the year. So if there's anything that comes to mind after this call, you can also just send me an email if you wanted to add anything to your responses from the survey, or if you're a newer member who has an idea for something that we should be focusing on, feel free to let me know and I can include that in our work plan. So I divided this up and tried to capture all the responses that were collected and put them in the order of how many times they showed up. And you can see the number to the side of each point is how many members mentioned that point in the survey. So in terms of what works well in 2025, we had a lot of members talk about our engagements with stakeholders, our government lobbying. So for example, for our new members, we held a TB Hill Day on Parliament Hill in September, which was really successful. And I think a lot of members got a lot out of that activity. The release of the Access to Medicine survey and engagement, that came up a lot, which we've mentioned on this call already. TB advocacy and increased TB funding, so our campaigns around TB funding more broadly. World TB Day is always a big moment for us. Our webinars, they always have a great turnout, a lot of interest from our broader network in those events. And just a shout out to the domestic working group, which has really been working to produce quality products over the last couple of years. And then on the next slide, I collected all of the answers that were more focused on our organization as a whole. So many people focused on how amazing the network is, just based on the fact that it is volunteers, and how smoothly we work, just based on the fact that, you know, we're all dedicating some time to accomplish our key goals. The organizational support that we get through results has been really key. Getting a fiscal host, which we're going to be talking about a little bit later, has helped build some momentum in terms of trying to professionalize at a network. It's a really great space just for sharing information. We're all working in the TB space in one way or another, but it's nice to just connect and have a space to share information. The possibility of raising funds, that was something that we worked on through 2025. The flexibility of the organization allows for ease of working on specific projects like surveys. The network just working well together, and many new links. So I think we made some really strong partnerships with government departments and other partners in Canada throughout this year. And I think I'll just keep going for now. And if anyone wants to chime in, maybe raise your hand or use the chat function. And then at the end of the feedback, I'll open it up to see if anyone wants to add anything. So on the next slide, we talked about what we can improve as a network in 2026. One of the most common responses was more cohesion between the working groups. So whether that is a meeting check-in or some kind of email communication, a representative from each working group, we still need to work out exactly how we're going to do that. But that's something that we'll try to do this year. Strengthening connections with other folks in the TB space in Canada. Continuing progress towards stable funding, reviewing the timing of meetings. So I think that's something that we could implement pretty easily, maybe giving more notice when we send out a doodle poll for a meeting to make sure that we can get broad representation from everyone. Taking a better lead when new projects are proposed. I think this is a tricky one because we have a lot of really great ideas, but maybe not the capacity to take on everything. But definitely taking a lead when it makes sense for Stop TB Canada to be focused on something. Better representation from Indigenous communities and from TB survivors. So within the steering committee, but also partnerships, that's something that we can work on. Seeing if we can find a way to host leverage grad students, webinars on specific TB treatments and diagnostics, engaging the network more beyond the steering committee. So we have a network that like over 1,000 people that receive our newsletter, for example. So how can we engage in that group more and utilize them for our campaigns? More opinion pieces that can raise awareness, members to advocate inside their orgs for contributions. So I think that was more for financial contributions for Stop TB Canada. And greater connection between the steering committee and TB People Canada. So for those who are not familiar, TB People Canada is a peer support network of people affected by TB in Canada that Stop TB Canada launched a couple of years ago. So I think it would be great to have a stronger connection between these groups and get the members of TB People Canada involved in our campaigns and decisions. Okay, well, keep moving. I know this is a lot of information at once. What should Stop TB Canada prioritize as a network this year? There were a lot of duplicates in terms of responses, which is great. So everyone seemed to be on a similar page. Ensuring that TB remains a priority kind of generally among funding cuts was a big one. Staying on top of efforts to build a national TB elimination plan, which has been a campaign that we've been working on for several years, and I think we'll touch on shortly. Building on the access to medicine issue. So after our report, we've had a lot of really meaningful conversations with stakeholders on access to TB meds. So continuing to push on that piece. And then building on that with the launch of the diagnostics survey. focusing on social determinants of health for TB, supporting TB People Canada, integration with other diseases, surveillance, increasing global advocacy. Was there another slide? I think maybe for organizational, yes. I think this is the last one, and then I'll pause. So engaging with partners, strengthening partnerships with key stakeholders, which I think we've done a really great job at just continuing to build those partnerships. Expanding advocacy to provincial territorial ministries. So predominantly our advocacy has been directed to the federal government, so maybe we can expand to the provinces and territories. Fundraising is a big one. Establishing relationships with key partners. So here there were a few that were listed. Clarifying links with the global Stop TB partnership. Working towards clear mandates for Stop TB Canada. Expanding the steering committee and developing working groups, which we've been doing. Professionalizing, building a strategic plan, and integration of TB work with Indigenous people. So as I mentioned, we have some great ambitions and plans and ideas. So I'm excited to work with all of you to actually implement some of these ideas to have an impact this year. And I see there were some points in the chat which I haven't been able to keep up with. So I just wanted to pause and see if anyone wants to add to any of these points, whether it was something that you thought was particularly impactful in 2025, something we could improve on, or building on this list of what we should be prioritizing as a network, because we will take that feedback to build out our work plan. So I will stop here and see if anyone wants to add. Elizabeth?
I just a comment about the access to medications things. I feel like it's hard to underestimate the impact that Stop TB Canada kind of banging about that has had on things moving. It always feels like everything goes so much slower than we wish, but really it's remarkable, and it's very much because of Stop TB Canada folks, like many Stop TB Canada people involved in many different sort of corners of this issue. So yeah, I guess I'm saying that partly for the new people. Like, it has been amazing to me, like the actual real life, although slow, impact on concrete things like that are difficult problems.
Definitely. It's cool to see how, as a volunteer network, the impact that we've had, especially on the access to meds piece. Does anyone else want to add anything? Or if you have suggestions, you can also reach me via email and I can feed it into the work plan. Okay, great. So speaking of the work plan, I think I will pass it over to Iris now to kick us off on a conversation about some of the big moments, key dates, conferences that are coming up in the next little bit for us to talk about where we should be engaging as a network. Iris?
Thank you so much. You can hear me, right? I can't see you, so if you have...
We hear
okay, thank you. I can't see you, so if you have any questions, or if there's any questions in the chat, please don't hesitate to cut me. But yes, so as you can see on this slide, we have our key moments. Throughout the year, you will see in red, it's the Q1 key events, and in gray, it's later in the year, but you'll have a good overview of the next 6 months, although we're already in February. So we've started with establishing the steering committee. This month, we'll have our NAR and TB conference, and we're looking to organize a national call to discuss key priorities and initiatives in advance of World TB Day. That will be in the next month, in March. There are Results Canada, with support of Stop TB Canada, always does this Lighting Up the Monuments campaign, and there will be meetups on World TB Day. And we have the Global Fund Secretariat that will come to Ottawa. So that will be a key opportunity for us to engage. In April, we're looking to do a webinar, maybe on TB and R&D. There will also be the Canadian Thoracic Society Conference in Calgary. And if I'm not wrong, the PHAC should announce its TB elimination strategy. So if anyone has any updates on that, or any thoughts on how we should engage or our reaction to it, that'd be very interesting to hear. In May, Results Canada is planning to organize an R&D science fair, and I think it will be key opportunity for Stop TB Canada to engage, specifically to showcase Canadian-based TB R&D and innovations. And June is to be determined, so we'll go in more detail of each of these events. But first, the NAR-NTB conference, maybe I can pass it over to Elizabeth, since I know you will be there.
Sure. So the NAR means the North American region of the Union Against Tuberculosis and Lung Disease, which is a real mouthful. So NAR, which is the only big TB specific conference in North America. So for a long time, we've had a Stop TB Canada meeting as part of that conference. It's just kind of a funny year, right, around travel to the US, and even for people in the US to be able to get to conferences, and all kinds of issues with the CDC and that kind of thing. I checked with the conference organizer. So far, there's only 20 Canadians registered to go to the conference this year, which is way, way less than usually make it. I will be there. I put in the chat, is anybody else on the call today planning to be there? If you are, let me know. So I think we would still have a Stop TB Canada meeting. It's probably going to be a lot smaller than it often is. So I think maybe what we'll do is, Crystal's going to be there. Great. Excellent. Okay. So we should connect. So maybe what we'll do is like more informal than when we've had bigger meetings. Although I may filter some of the annual report stuff if I can. One of the things we should probably decide is whether we want to kind of have a video connection and have Petra and Tina talk as the current co-chairs. But again, it's probably going to be a small meeting, so we could talk about that offline. But definitely, Crystal, it'd be great to connect, and also great to see you in person. So the other, the big thing with that meeting is what we usually do is kind of what has Stop TB Canada been up to, and get ideas from the group about priorities and ideas for new issues that Stop TB Canada might be able to tackle, recruit more volunteers, the access to laboratory diagnostics is something that came up at last year's NAR meeting, for example, that we've been kind of slowly moving ahead with as another new project. So it's been a useful forum. Obviously, not everybody gets there though. So we've been calling it Stop TB Canada annual meeting. I'm not I'm not sure it really is. Like, it's not something that all Stop TB sort of members or steering committee people would be at, but it's certainly a meeting that happens annually. So.
Thank you so much. If there's any questions, please again don't hesitate to cut me as I can see.
Yeah, I will cut you.
Thank you.
I was just going to suggest, because I was in the domestic working group meeting a week or so ago, and we were talking about potentially shifting the Stop TB Canada annual meeting to the now what is it called? Canadian Respiratory Conference that's happening in Calgary, because it seemed like we would have a larger Stop TB Canada kind of cohort there, or maybe not shifting, but having like another kind of space to connect with Canadians in the TB space. And then I did have a slide, I think it's 2 from here, Iris, if we want to just lump those conversations together and see if it's worth having another meeting there, or if that's like a better space, if there's going to be more Canadians there. And I think Courtney and Dina mentioned that maybe there would be space for a meeting there. So I'm not sure if anyone has had any conversations around that.
Yeah, I will say there's never a perfect meeting. Like infectious disease and public health people might not go to this one. If you're, working with a community organization, it would probably not be something you might necessarily go to, that kind of stuff. So there's no perfect answer. So from that point of view, I feel like it's kind of nice to take advantage of a bunch of meetings if there's capacity.
Yeah, and it could be pretty casual, and I'm happy to help with like a few slides if that's helpful, but I think it's more so about just kind of having a conversation with whoever's in the room about priorities and getting their feedback. So maybe we can move on to World TB Day, Iris. And I guess if anyone is going to NAR, reach out to Elizabeth. And Elizabeth, you can let us know if you need anything for if you do have a meeting, sure. Even if it's just casual, we can pull something together.
Thank you so much, Lee. So as we said, around World TB Day, we have the Monuments campaign. We've already had 220 requests with 31 monuments approved to be lit in red to raise awareness about TB. There will be informal grassroots meetups at the sign, and I'm sure that Lee has already shared or will share shortly the link to participate for those who want to contribute to this campaign and try to get their monuments from their own city lit up in red. We also are planning a national call to discuss key priorities and World TB Day plans. For now, we're envisioning the last week of February, and we'll shortly have a date set for this call that is more informal and in which Canadian partners in the TB space meet up and discuss about their events and how we can align on each other's initiatives. With that said, at that for World TB Day, there is Peterson, the executive director, I think it's the exact title, maybe I'm wrong, of the Global Fund for TB, HIV, and malaria. He will be present in Ottawa in March 23rd and 24th. And I guess we wanted to have this discussion with you on how we can best leverage his visit and how can Stop TB Canada support maybe a meetup or an initiative around that visit. Again, I can't see the screen, so please jump in if you have any ideas or any thoughts on what we could do around that time.
I'll jump in just with a few thoughts. So I think, Results always does a fantastic job in lighting up the multiple monuments around the world. And I think every year it is important that we come out with a really clear message why the beautiful monuments are all lit up in red. And given the fact that the PHAC strategy is coming out a month later, it's a really great opportunity for us to put the domestic calls for action in the forefront, and really re-emphasize that it's fantastic that PHAC has heard us, or that there is a TB elimination strategy coming out for the whole of Canada, but that we want to make sure that there is funding behind this and that there is operational support behind this so that provinces can implement these plans and that we don't have to wait for any operational resources but that they should be announced with the plan. I think some of those kinds of messages are just too good of an opportunity around World TB Day not to bring forward, because we know that right now there is no budget commitment to this strategy. So it's very likely that the strategy will come out, the task force will be dissolved, and there is nothing. It's up to the provinces to. I'm kind of paraphrasing in a stark way, because I think the opportunity of Peter Sands coming to actually bring him maybe to more into the domestic space, and to have him emphasize that message as well, or maybe see why TB in Canada is on the rise. Maybe is there an opportunity where he could come and meet some group of newcomers? Maybe could he come and visit somewhere, a First Nations activity that is being planned? I would love to hear if there are ways where we can leverage his visit to not just hear, thank you, Canada, for donating money to the Global Fund, but to actually make him also see that TB is still an issue within Canada, and with that profile some of the domestic messages that need to be emphasized. So I wonder what people think about that.
Yeah, can I jump in, Petra? Just have some
Yes,
ideas and a question. First of all, who will be hosting Peter when he's coming? Like, who is the inviting organization? And then how are the partnerships between Results and Stop TB Canada? Sav is this inviting host, or you are hosting him?
I'm curious to hear from Results, but we didn't invite him.
No, we didn't invite him. The Global Fund Secretariat has been looking for opportunities for Peter to visit Canada for a while now. So these are the only dates he was available for. So one of the things they wanted to flag, the reason why he's coming is also because this is his last term as ED. He's going to step down this year. So he's doing a last round of visits to a bunch of countries, including Canada. So he wanted to, raise the visibility of the Global Fund before he steps down, thank Canada. Also, they are quite interested in private sector engagement around the Global Fund. So we aren't hosting, but we will obviously support Peter's visit to Canada. And just to note, he's here only for slightly less than 2 days, like 1.5 days, close to 2 days. So we will support the Secretariat in his engagements. If that answers
okay. So I just wanted to understand how we can influence or suggest activities for his agenda, and that's why important to understand who is hosting him and how the operations, because as far as I understand, it's probably will be very formal agenda setting processes. So it's important to get on board probably as quickly as possible. And in terms of ideas, I think I don't know if you have time and capacity to accompany some of the meetings, if, for example, with Peter Sand and media presence. Yeah. Also to echo what Petra said about importance of the message for the World TB Day and about the Lighting Up campaign. So I think it's important to understand who is the audience, right? So because, for example, we are lighting up the some monument. I myself joined this activity in Toronto last year, but I would like to understand what is the message, whom we are going to reach, right? So if it's possible to have some media presence again, and like a press briefing, if, for example, Toronto Public Health is present, then maybe it will have like a more impact and it will be somehow in the news, or at least to have some media kit where we could support posting in social media, right? So yeah, just to be clear, like it is one purpose to have this event as a networking between us, another purpose to have it for awareness raising or for some policy impact. And then again, who is present, I think it makes difference because people need to understand why this, why the monuments are light up. Thank you.
I can jump.
Yasin has his hand up. Sorry, Iris, I know you can't see.
No. It's good. Thank you. Got me.
But if you want to answer first, I am happy to speak after.
No, go ahead.
Sure. I'm just kind of brainstorming what could potentially be organized. Obviously, the one contact that comes to mind in Ottawa would be to get in touch with ITK, and I'm happy to facilitate that contact. Obviously, there's small Inuit population in Ottawa, but ITK's offices are there, so we might be able to get someone kind of higher up in the organization, so a political link with the organization representing a population that's particularly affected in Canada could be interesting. What exactly, I think that's kind of up to us to brainstorm what we want to get out of that. But and I'm sure that they'll do stuff for World TB Day. So maybe it's kind of I can ask if they already have stuff planned, if we could put the other way around, invite him there.
Exactly. Or make it maybe even invite some of the First Nation groups from Gatineau to come out, or we go to a celebration in Gatineau, or somehow kind of make it joint. I know the Inuit population and Gatineau probably don't even collaborate that much, but I'm just thinking of an opportunity to, and Nathan Obed inviting Peter Sands would be a great I think that would be a great idea because that raises the profile of ITK and that's needed. And it also kind of gives Peter an insight to speak a different language than only the global or the fundraising when he comes to Canada. So I think that's a great idea, Yasin. If you have inroads there, I can offer to speak to Indigenous Services and some people there to see what they have planned because they reached out in December to us to see if there was anything that we were planning, whether their Minister of Indigenous Services should be involved. So I'll reach out and see if they have started planning anything. But that together could be,
Can I come? This is Alan Shi.
Yeah, please come in.
Yeah, thank you, Iris. Yeah, I want to talk about maybe some ideas I want to share regarding Peter Sands' visit in Canada, looking globally to the global response against tuberculosis. We know that until now, the Global Fund did not send to countries, the allocation for the GC8 because they are rethinking or remodeling the way the allocation was done. Even if we think that we only have minor changes, but these changes end up, giving as usual less of this allocation, to tuberculosis. And if we know that, Global Fund is funding around 8% of the global response against TB, what does it mean for me? It means that it is an opportunity to talk to Peter Sands and to let him understand that, the importance of Global Fund regarding the response against tuberculosis is critical. And Global Fund has, to discriminate positively tuberculosis in this, difficult, context, meaning the financial landscape we are living now, where HIV is still up, malaria will be still up, but for tuberculosis, it will be a different story. It's a global fund step back in terms of funding. Knowing that Canada is one of the 6 major donors to the Global Fund, I think the Stop TB should highlight this to Peter Sands that our money, we want it to be prioritized, X, Y, Z things, so that, we can explain to the Canadian public that, the money we give to the Global Fund has been used in the right way for the most vulnerable population, which are, I think, people living with tuberculosis or people that are exposed in the, in the low income setting.
Yeah, thank you, Alhaji. I completely agree that it's out of balance in terms of what the Global Fund is investing to TB. And if he's coming for World TB Day, we have no better kind of argument than actually put that in front of him. So let's take these ideas back to maybe the operations group. I've heard an NGO roundtable sort of idea, questions around can we or not do something with parliamentarians, and would love to hear what is possible. A social media toolkit is a great suggestion, and that shouldn't be too hard to put together because we have so many wonderful materials already. So in the planning towards our national call, Iris, maybe together with Lee, we can have a brainstorm on taking some of these ideas forward. And Ekta, I know you're meeting with the Global Fund Secretariat tomorrow, so maybe also kind of test the water on their side, whether he already has a completely fixed agenda that he has set up himself, or if there is space to maybe meet with ITK or some domestic partner, and whether he would be open to that. Because I think I would think that from our side, that would be a really good invitation. And we can definitely make briefing packs for Peter Sands when he's here. All right, back to, Julia, yes, go ahead.
One quick intervention. Maybe also to reiterate in this briefing pack and meeting with Peter Sands, importance of reversing top-down north to south approach, but also the desire of the north to learn from south, especially as Global Fund was supporting a lot of capacity building activities, country coordinating mechanisms, and other success stories. Maybe this will be something that will open some opportunities for collaborations in kind of changing the vector of or adjusting the vector of this cooperation. Yeah, so. And also to add, I agree that it is important to ask to what the citizens are asking to allocate their money for, but also maybe to go into some more specifics, because the Global Fund was negotiating what is essential services, right? So, and it's kind of, biomedical focus, of course, is a priority. Of course, people need access to treatment and medicines and diagnostics, but also essential services in terms of support, in terms of civil society and community engagement. So somebody we are here, we could have a word in order to also reiterate that this is also important, that this is also essential. So that's it. Thank you.
Yeah, no, great point, Julia. And I think you are on the hook now to help feed into the briefing note for Peter Sands when he comes. So for sure, we'll be circulating any draft products to the whole steering committee. And if someone has some time to help draft things, please reach out to Iris or Lee or myself, and would be happy to get you involved in some of the preparation of the national call and World TB Day activities.
Yeah, I would be happy to. Thank you.
Thank you. Sorry for putting you on the spot, Julia. Iris, back to you.
Thank you so much. I wanted to also briefly mention that on World TB Day, Results Canada will organize a meeting for Results Canada volunteers in Winnipeg that will be around World TB Day. It will mainly be to teach them how to advocate, but it will be based on TB. So if anyone is interested in joining that event, I will obviously share the invites and registration. That was just like a side note, since it's going to be on TB. And with all of this happening on World TB Day, we thought that we would still want to do a webinar, the annual webinars, but maybe postpone it to April. And this is something that we wanted to discuss with you. We can also discuss that in the national call to see if people really want to do the Stop TB Canada annual webinar on World TB Day, or if this timeline maybe fit better with the schedule, since there's going to be a lot happening this year on World TB Day.
Can I jump in?
Yeah.
I would just, based on my experience running Stop TB Canada webinars, it usually requires a solid month of prep for speakers and getting everything ready, advertising. So I would say if we're having the national call at the end of February, that might be too late to get feedback on whether the event would take place on World TB Day. So I think that would have to be up to us if we're going to do that. But yeah, it usually requires about a month to prep.
Thank you, Lee. Does anyone have any thoughts on this, or should we just wrap up? We can also discuss online before the organization of the national call.
I think you're right, Iris. Since this live event is kind of evolving a little bit right now, let's wait for the national call and potentially push to April, depending on what the situation with Peter Sands brings together. If that is a good opportunity and we're going to invest our time in that around World TB Day, then for sure move the webinar to April. And I see that Yasin has his hand up. Yasin, go ahead.
Yeah, in the similar, I think it depends on what we want to achieve by the webinar. But if it's not media related, I think we shouldn't give ourselves the pressure to try to cram it on World TB Day. I think that's kind of an opportunity of reaching out to media, that kind of like public facing things. Otherwise, if it's for us or for people interested in TB, otherwise, I think it makes sense to plan it at a different moment in order to not kind of have competing priorities and people being torn here and there at the same time as well.
Okay, great. And I see that Elizabeth is saying that PHAC is planning a webinar on World TB Day as well. So
yeah,
we did reach out to PHAC for a meeting to understand better what they're planning with the launch, but haven't heard back. Maybe we need to follow up again with Tiffany to see if she's willing to meet. I'm looking at Lee if we can do another nudge and see if we could get a meeting with Tiffany to plan the launch. Thank you. Dr. Ferdowsi?
Yeah. Just on any topics of interest and key themes for the webinar, I think it would be opportunistic and relevant to focus a bit on the international funding cuts that have occurred in 2025 and its effect on the global TB program, the national TB programs, etc. The WHO World TB report, Global TB report of 2025 brought out that mathematical modeling has shown that between 2025 and 2035, due to the cutting of international funding, there is expected to be an additional 2 million deaths and an additional 10 million cases over 10 years. So all these are, I think, fresh topics to bring in instead of the usual thing, and also the very important subject on a global basis for the Stop TB Canada's global view or lens of that this is a wake-up call for countries to give up on donor dependency and to hunker down on political commitment and national funding. So I think these are the few topics which would be of interest and relevance in this webinar.
Thanks, Firdousi. And you have just beautifully highlighted what the NAR is going to be, the panel that Elizabeth is going to chair that we put together as Stop TB Canada and Stop TB USA is exactly on this topic. So maybe we need to film that and then we can take it out as our Stop TB webinar. I'm joking. But yes, absolutely important points. And for sure, we'll need to keep communicating about that. I see Jody and then Ekta.
Thanks, Petra, and thanks for Firdousi. That's a great idea, but I also wondered, TB vaccines for adults and adolescents are on the horizon, and I wonder how much talk is going on about that now, because there's a lot of preparation that needs to happen for those to roll out when they become available. So just throwing that out there.
Ekta and then Elizabeth. Sorry, Iris, I'm not trying to take over from you, but I know you're still sharing the screen. So Ekta, go ahead.
Yeah, just a couple of thoughts. One is on Peter's visit. I'm sorry, I'm going back. But I mean, given that Peter's stepping down, I don't know if Peter will speak up for like domestic issues or like, but I think it's a good opportunity for us to connect Peter with domestic stakeholders and take it back to the Global Fund Secretariat. Because right now, I think it's slightly difficult for us to position Global Fund in the domestic space. So the connections the Global Fund builds at the domestic level will be helpful for the Global Fund and us as well in our advocacy. So I think it's a good opportunity for us to connect with domestic stakeholders. The second thing I want to flag is if there's interest, we are also happy to organize a civil society roundtable, a stakeholder roundtable at Results Canada's office as well around his visit. This is something we've done in the past. And the other thing on parliamentary engagement, Lee, to your question, we won't be doing any parliamentary engagement right now. The only thing, and also because the Global Fund has already got their pledge, so I don't think we should use our political capital for that. But we will be providing a list of stakeholders for them to connect with. Sorry, I had one more thought, but I can't like immediately recall. But I'll come back to it.
Thanks, Ekta. Elizabeth.
I was just going to say, like, there's no reason we can't repurpose those conference talks, right? People will already have had to come up with a talk. And for them to join a webinar would be not much additional work if we could coordinate the logistics. So.
Fair point. Ekta? Your hand is still up. Is that a new hand?
No, sorry. It's an old hand. Okay. Oh, yes. I just like the thing I wanted to think of just came back to me. If there's like PHAC launches its public, the TB elimination strategy, I think we should. I know PHAC, unlike GAC, is really shy to celebrate anything, but I feel it's a huge advocacy win for this network because we've been pushing for this for the last 2 or 3 years. So if PHAC goes public with it, I think it's an opportunity for us to take to social, do what we got to do to celebrate. But I think it's a huge advocacy win for all of us in this group.
100% agree. Yep, absolutely. And keep the pressure on. But I absolutely agree that we need to celebrate it and that we need to welcome it and dissect what's going to be happening with it too. Elhaji?
Yeah, thank you very much, Petra. I fully agree with you, Ekta. when you said that, maybe Peterson won't be really interested on, on the domestic tuberculosis in Canada. It may be right, but maybe opportunities we can explore is, the hooking Peterson to the private sector of Canada, working on research of development in general, since the Global Fund is today focusing a lot on everything related to new technology, everything that can help expedite all these diagnostic or this treatment or this regimen against the different diseases. Something we could do, and it can help tomorrow advocate on behalf of Canadian public that something is happening between Global Fund and Canadian private sector in terms of economic returns. And I fully encourage as well having a session between the civil society organization and Peterson. It happened years ago, I think, if I remember correct, 2020 or 2021, if I'm not mistaken. I think it was 2020. And we had Peterson in Results Canada, and it was a time of Robin Montgomery. It was very helpful having the deep insight of the Global Fund Secretary regarding certain critical point we discussed sometime publicly, and where we don't know the exact orientation or guidance or direction coming from the Global Fund.
Yeah, thank you, Alhaji. And yeah, agreed. Ekta is also throwing a thumbs up. Okay, in the interest of time, I think we need to get back to Iris's next slides. Iris, please take over from me. So we already talked about the Canadian Respiratory Conference. Go
And
ahead.
I think we're gonna go back to Lee with Lee or you.
Actually, it's Petra.
Yes, thank you. Sorry, I wasn't sure.
Thanks.
Okay, well, we can go to the next slide then. And I'm
Sorry.
sorry it's getting very dark in my room, but I'm still here. And thank you for all the excellent ideas on the webinars. I think they are all noted, and they will not go in vain. We will definitely keep them in mind because we will be planning more webinars this year. So I just wanted to brief, as I mentioned in the opening already, and it's come up in the notes, when you go through a long list of what can we do better, as it's very clear to me that this voluntary network is incredibly ambitious and resourceful and fantastic, full of ideas, which is amazing. However, to properly support that, it would be great to have a much more solid project management for the various projects that we have. And that came also out of some of the suggestions on how to improve. Some of the suggestions were around operations, and some of the suggestions were around strengthening how the coordination is. But I think what we've tried to do in 2025 is really look at professionalize our situation so that we have, in addition to the fantastic work that Results is doing for the global working group, that we have a secretariat function that can also support the overall work of the domestic and the overall work of the Stop TB Canada. So we've set up with BC Lung in the fall officially a memorandum of understanding where BC Lung is now our fiscal host. They're holding our bank account, and they are providing quarterly updates on what the financing is. With the funding that we had in there, because we had a little bit of funds from individual donations, we've been able to also keep Lee on a contract to do the transitioning towards IRIS and help us out with the instituting of this new steering committee. So it's been instrumental. Any one of you, we have talked about a membership opportunity for organizations that are part of the Secretariat to donate on an annual basis some amount of money to benefit from TB. I would really encourage you to go back to your organization and see if it's at all possible to provide some financial support, even $500. whatever it is, in this stage, it would be a donation because we do not have a formal structure in place, or we don't have a formal membership mechanism in place. But we're exploring various opportunities on how we can get some money on the table, even in a small way. So part of our work for World TB Day and beyond is also looking at a fundraising campaign. So as Lee put in the chat, we have a donations page. Just in case you know of anyone that is looking to place some of their funding in a good cause, now you can help us fundraise. If you have, by any chance, suggestions for foundations or suggestions for organizations that do request for proposal for small community organizations, we would love to work on a proposal that we can put out there to them. We would love to work together with you to approach these connections and see if we can potentially receive some funding for Stop TB Canada. So this is an appeal to all of you as steering committee members to think along in this upcoming year, where we will be starting to look more formally into the issue of funding opportunities. And Michelle Chong, who's sadly not here today because she's with her kid in the clinic, but she's stepped up to be our treasurer, and she's going to be taking part of the operations working group to make sure that we are on top of all the finances and that we jointly kind of whatever we're planning, that we're holding ourselves properly accountable as well in our financial books. So that is one big important piece, and we're very grateful for BC Lung for taking on this role. Secondly, we've had conversations with the domestic working group with the Lung Health Foundation. The Lung Health Foundation, and this is in the idea of TB has been always part of the Lung Health Foundation and the various provincial lung associations. Several still have tuberculosis clearly as part of their mandate, including BC Lung in BC, including in Saskatchewan, including in, I think, Manitoba, but not every province in their own association has TB as their priority. The Ontario did have TB until 2018 and then let go of it. So out of that time, the Lung Health Foundation has grown, which is looking at respiratory issues. They look at asthma, COPD, multiple other lung cancer related issues. And they are, in the conversations, they are very open to bringing TB back into the larger umbrella of lung health. So the Lung Health Foundation also supports a Lung Health Alliance. And the Lung Health Alliance, sorry, this is all a little complicated. It took me a while to get the governance right. But the Lung Health Alliance are all the different provincial associations, plus the Asthma Alliance, plus the COPD activities, plus the lung cancer work. They are all part and parcel of the Lung Health Alliance. And so this is a joint advocacy effort. Usually in September, they go to talk to parliamentarians. They have an activity where they reach out about the importance of respiratory in the broader sense, lung health issues. And they invited Stop TB Canada to become part of the Lung Health Alliance. It's a first step to be looking at more an integrated way towards lung health issues beyond TB only. So I would love to hear what the steering committee thinks about this and whether this is a worthwhile effort to pursue. And then lastly, as I already mentioned, the funding opportunities. So as one concrete step with BC Lung, we have put 2 community grants together that we're trying to get the funding for, and BC Lung has put the paperwork together for us. So we're in that process of professionalizing our fundraising campaign. And for any of your new steering committee members, if there's anyone who has a background or an interest in any governance issue, fundraising issues, please feel free to join the operations working group, because we can use all the extra hands this year in this type of work that we're going to be putting our weight into. So I would like to open up and see if there's anyone who wants to comment or ask questions while I turn the light on behind me so that you can see me again. Julia?
Yeah. Petra, first of all, I would like to volunteer for operations working group. So I don't know if I need to write to you, or it's okay if I said it on the phone.
It's
The call.
noted right now. You're very welcome.
Yeah, and also I saw recent news because there was this International Development Week, right, in Toronto, and the news that Intercouncil Network at the Ontario Council of International Cooperation, they just announced 36 million Canadian investment in support of global citizenship. So as far as I understand, has been just announced and the money allocated, and I think there is probably a way to apply for small level organizations, but I'm not sure how, because StopTB partnership is not registered. Maybe it could be somehow explored how to apply there, maybe through the partners, through BC also through results. Yeah, I just wanted to flag it if you didn't see it in the
No,
news.
I had seen it, and I think this is exactly the type of work that we need to chase and follow up and look into, and see how we can apply and find out when the official calls are. So yes, thank you, Julia, for joining and looking forward. And yes, if I think this is going to be an ongoing conversation. It will come back to both the global and the domestic working group as well. So you're not missing an opportunity if you're not jumping on it right now. We will make sure that we will get you all involved somehow or some way. So yeah, thank you. We'll keep the conversations going and appreciate any input. If you have thoughts, just write to write to me or Lee or Iris or Ekta or anyone, and Julia from now on as well. And I wanted to also say that our plan is to improve the communication between a global and a domestic working group. We're going to plan for sure on a quarterly basis that we bring both chairs of the global and the domestic working group together with the operations team so that we, on the bigger issues, before you have your separate meetings, that we're all on the same page and that there is a kind of an easier flow of communication about what's happening. So that's one of the solutions. And I think there are some other things that we can try, and we'll get back to you before the next steering committee meeting. So I'm back to Lee.
Go ahead, Courtney.
Oh, yeah, I was just going to ask if we could reach out to the Stop TB Canada directory that's broader than the steering committee members, and find out if people just want to update their membership in that directory, and see if as the comment says in the chat, there's an opportunity to ask people to provide technical guidance to our working groups on certain projects, because that would be helpful, I think.
Yes, absolutely. And I think if people put in their profiles that they are available as for technical assistance for TB programs as consultants, that is definitely a opportunity to source, and we can steer countries or whoever is looking for additional consultants in that direction as well. I think I've sent even in the last week, I've sent 5 people to the TB directory. So there are definitely, it's a good opportunity. And maybe we can work on a nice letter for the larger network and everyone on the mailing list that also highlights our donation page. And so maybe a specific targeted, can you update your profile? Do you know anyone that can help us fundraise? Are you available? Here are some prompts in terms of how you can update your profile. Let us know if you're interested in any of these issues, or are you available as technical assistant, etc., etc. So maybe another thing on the to-do list.
It's a great idea. Great. So we are at time. If there's any other business that's urgent, speak now, or you can write to us over email and we can we can connect that way. I know there was a lot of information, especially for new members today. So we will be sending, I think Iris, over the next couple of days, we'll send the recording for everyone. So if you want to go back to any part of the discussion to review, as well as a list of kind of the high level notes and action items. And then I will be reaching out to all the new members to match you with an appropriate working group, whatever you're most interested in, so that we can set you up on that. The working groups do meet on a monthly basis, so you'll get those calendar invites in your calendars shortly. And I think that's everything we have. Iris, if you can be sure to save the chat. There are a lot of really great ideas there that we don't want to lose. But thanks so much for joining the first quarterly meeting. So nice to meet the new members and see the returning members continuing to work with Stop TB Canada. Thank you, everyone. Enjoy the rest of your day.
Thank you.
Bye.
Thanks.
Thank you.
Bye.
Thank you.
Bye.
Bye. Bye. Yeah. Good.
You okay, Iris, with the chat, or did you?
Yeah, I'm trying to save it. That's why I was just.
Well done, both of you. Excellent
And
preparation.
maybe just stop the recording.
Oh.
Yeah, thank you. Let me do that if I can go back. The technology is always different every time.